for your talk. We move on to the next speaker, my dear friend Gianfranco Pasut from the University of Padua, with the talk Hyaluronic acid product conjugate for the local treatment of osteoarthritis. Thank you, Gianfranco.
So, good morning to everybody. Just let me thank you, the organizer, and especially Professor Bottini for the kind invitation to present my work about hyaluronic acid protein conjugates for the treatment of osteoarthritis. So we are moving from rheumatoid arthritis to osteoarthritis here. So I think I don't have to introduce to you what is osteoarthritis. Probably you know better than me what is this disease. This is a chronic degeneration of the joints, mainly involving the cartilage, but also the subchondral bone is playing an important role in the development of this disease, especially when it's associated with the osteophyte formation. In terms of pharmacological approach, we have symptoms-modified treatment that are directed to treat mainly the pain of this disease. But what is more important and looking for are drugs that are disease-modifying treatment, so drugs that can at least decrease the rate of progression of this disease. Of course, since the main problem with osteoarthritis is when this disease involves the large joints, local treatments may be preferred because you can avoid the systemic exposure to the drug and the systemic effects. So some studies have been proposed salmon calcitonin as a new treatment for osteoarthritis. Salmon calcitonin may have a dual role for the treatment of this disease. It may have a role on the bone by inhibiting the osteoclast-mediated resorption, and then it can have a role on the chondrocytes, stimulating their proliferation, stimulating the increase of synthesis of proteoglycans and the synthesis of new cartilage, and also salmon calcitonin may inhibit collagenase activities. Of course, but if you inject intraarticularly salmon calcitonin, this will be immediately cleared and you will have a systemic exposure to something that you don't want for a local treatment. So if we look at the mechanism of intraarticular clearance of locally injected drugs, you can see that for small molecular weight drugs, you have a clearance due to very rapid bisynovial clearance through the synovial blood vessel, but also by lymphatic system. So small drug like salmon calcitonin will be fast cleared, and therefore it will be nice to have a nanomedicine approach that keeps the drug at the site of action to prolong its activity and also to avoid the systemic exposure. So we think about what about polymer conjugation? We have a long experience with polymer conjugation, especially with polyethylene glycol, but in this case, other researchers have been investigated a pegylated 40 kilodalton human growth hormone for the treatment of osteoarthritis. And what they have demonstrated is that not only this huge peg is not able to keep the conjugate inside the joint, but after the clearance to the body, you have a prolonged action because you have not only the single human growth hormone, but you have the conjugate. So the drug is moving anyway into the body, in the blood vessels, and you have a longer pharmacokinetic. So probably PEG is not a suitable polymer for conjugation, but what about alternatives? So we start to think about hyaluronic acid for different reasons. One of these is that hyaluronic acid is already used for the treatment of osteoarthritis as a viscous supplementation agent for especially high molecular weight hyaluronic acid. And then it has been demonstrated that hyaluronic acid is able to inhibit the expression of metallomatrix protease. So it may have a nice action in combination with salmon calcitonin. We can have not only the possibility eventually to keep the drug at the site of action, but we can combine two activities together to get a better response. So in terms of chemical strategy for the conjugation, hyaluronic acid is not easy like polyethylene glycol because it's a multivalent polymer, and if you directly activate just the carboxylic group of hyaluronic acid and make that to react with the amino group, for example, of a protein, you will obtain a cross-linked product that is not completely useful. What is important is to develop a specific chemistry that allow you to link the protein only on one side. So you still have several copies of your protein linked to the polymer backbone, but only in a single position, thus avoiding the formation of cross-linked products. So some researchers are trying to develop this strategy by introducing aldehyde into the polymeric backbone by periodate oxidation of these two pyxenyl hydroxyl group. But in this case, first you have the break of you modify the backbone structure of hyaluronic acid, and then you will obtain two aldehydes in close proximity together that may both react with the protein. So still the chemistry is not really clean. And so we have developed a different approach. We introduced this spacer into the some carboxylic group of hyaluronic acid. This has an acetal that can be activated by hydrolysis, acidic hydrolysis, to form an aldehyde group. And consequently, we will have only one side. And then this type of spacer is stable. We can easily determine by NMR the activation degree. And so by exploiting a conjugation strategy at pH 6, we are able to link this aldehyde specifically at the N-terminus of protein, at the alpha amino group present at the N-terminus. So we have only a single site of conjugation for most of the protein. So after obtaining the conjugate, we verify if this is active in vitro. We investigated the CLINAM production in these porcine kidney epithelium cell lines that constitutively express the calcitonin receptor. And we see that the calcitonin and the conjugates basically activate the cell line on the same level. And in vivo, when we inject endovenously the conjugate, we observe that the conjugate is still able to reduce the calcium concentration as salmon calcitonin, of course, with a longer effect thanks to the conjugation. So, but what is important is this conjugate kept into the articular space, or it is going into the blood distribution. If you inject salmon calcitonin or calcitonin mixed physical mixture with hyaluronic acid, you can see that easily this tuteract, the salmon calcitonin, will be cleared into the blood circulation, and you will have a systemic effect. Differently, the conjugate will not show any pharmacodynamic effect on calcium concentration due to calcitonin. So in theory, the conjugate is kept into joint clearance, joint space. And we also demonstrate this by labeling the conjugate and look at the fluorescence into the blood. You see that calcitonin, after already 15 minutes, most of the calcitonin is in the blood circulation, while the conjugate still remain into the joint. And we also demonstrate this with another conjugate with human growth hormone. We also developed this conjugate for investigation against osteoarthritis with the ELISA determining the human growth hormone concentration in the bloodstream. You see that human growth hormone is quite fast cleared from the joints. Instead, the conjugate is very slowly cleared from the joints. Of course, in this case, human growth hormone performs activity within two receptors. So we got a huge decrease of activity, and consequently we decide to go ahead with the salmon calcitonin conjugate for the other in vivo study against osteoarthritis. So we investigated our conjugate in this rabbit model of osteoarthritis, basically by transection of the anterior ligament of the knee. You have the development of osteoarthritis between one month. So in this scheme, we treated the animal with 3 injections of the control, just the vehicle, salmon calcitonin, or 3 concentration of our conjugate. First of all, if you look at the joint, at the condyle of the animal, you see that there is a clear evidence of damage when the animal were treated with PBS. The same with just the hyaluronic acid. There's no clear effect with the polymer alone. But with salmon calcitonin, already you see that you have a nice effect. Of course, salmon calcitonin is performing its activity, so it's good. But if you inject salmocalcitonin, you will have also a systemic effect that you would like not to have for a local treatment. And what is more interesting and nice is to see that the conjugate is performing better. And if you look at all these damage score, you see that the conjugate has nicer results with respect to the calcitonin alone. And also investigating the histopathology of this lateral femoral condyle and the right stifle joint, you see that looking at this table with different score, you can see that the conjugates at the same concentration of salmocalcitonin gave a better response and a good response against this osteoarthritis. So to conclude, some remark about the hyaluronic acid as a carrier for osteoarthritic drugs. So if you are thinking about to link a protein, you see that the polymer can preserve the activity. Of course, this is case by case. In the case of human growth hormone, we got a higher reduction of the activity because it depends on the mechanism of activation of human growth hormone receptor. And so, but still, you can have the activity, and if you are able to preserve for a longer time your drug into the joint, you will have an advantage at the end. It is a natural and biodegradable polymer, so you can use this polymer at very high molecular weight. It is also recognized by specific receptor. We have not investigated if this is playing a role with osteoarthritis, but there are many specific receptors that recognize hyaluronic acid, and this eventually may be an advantage if you want to target some cells. And then it has per se, the polymer per se has a biological activity that can be useful for the treatment of osteoarthritis. Of course, there are also some disadvantages, which is mainly the high polydispersity of hyaluronic acid, which is obtained by fermentation. So it's not like a low polydispersed polymer like polyethylene glycol, and consequently you will have a less homogeneous product. But again, this is for local treatment, so since already both this polymer is already used for this treatment, it can be suitable for this such type of treatment. So last thing, to thank you for your attention, and thank also the people that helped me with the research.
Thank you for the presentation. Any questions?
Hi. I have some question. So I think your therapeutic results are very convincing, but I wonder about, because you really try to keep it linear, right? Hyaluronan, yes? And I just wonder whether it's really true, because you really didn't want to make some kind of aggregates from your protein hyaluron conjugate. But so we see, for example, that hyaluronate, even oligomeric, it always aggregates. Non-modified, modified, always aggregates in a nanoparticle, actually, like structures. Mm-hmm. And also, so you try to introduce the spacer, right, at certain spots, but your protein probably has more amino groups than one, right?
Yes.
Yes, so there will be cross-linking.
No, because because this is a very known. When you perform the conjugation at pH 6, all the amino group of the lysines are protonated, and only the alpha amino groups of the N-terminus, which has a lower pK, is non-protonated. This is a very known chemical strategy. There are products on the market, for example, the pegylated granulocyte colony stimulating factor has been obtained with this strategy, where the PEG is linked just at the N-terminus of the protein. So you don't, basically when you perform this reaction at pH 6 or 5.5, all the amino group, the epsilon amino group of lysine are fully protonated, and they will not react with the aldehyde.
Okay.
And then, of course, you need the aldehyde and a reducing agent to reduce the shift base that has been formed.
Okay. And what molecular weight of the hyaluronate
We use the 200 kilodalton.
200 kilodaltons.
Yes.
And it was easy to work with?
Yes.
Okay.
Yes, with the 200 kilodalton you can work. When you go up to 1 million, you have a gel. It's too difficult. It's a mess.
Okay. Okay. Thank you.
Yeah.
I was wondering, you mentioned the biological activity of the hyaluronic acid per se. Did you measure in your study MMP activity?
No, we don't. No, we don't. We found in other publication that this has an activity, but for us the main reason was to keep the salmocalcitonin inside the joint. So then this was an additional feature. So really, if you compare salmocalcitonin activity with the conjugate, you don't see huge difference. Of course, salmocalcitonin is active per se, but of course here the main advantage is that you don't have a systemic exposure to salmocalcitonin, so which is good for a local treatment to keep the drug inside the joint.
More questions? Well, I have a last very quick question. You mentioned before they use 200 kilodalton instead of higher, but usually cross-linked hyaluronic acid is used now for treatment because it persists for a longer time in the joint.
Yeah.
So, what is the trade-off?
In terms of the hyaluronic acid used as a viscosupplemental agent for osteoarthritis, 1 million, 2 million, is not cross-linked. There are some products that are physically cross-linked. Basically, they have some hydrophobic chain that form an hydrophobic interaction to form a gel. But this is for viscosupplementation. So in our case, to work with a 1 million, we try, but then it's difficult you have a gel, so the formation of the conjugate is not so easy, and then the injection will be more problematic after the linking of the protein.
The idea is to make the physical cross-link after. So if you can join, exactly. So
yes, I understand. But then if you do it after, you have a protein into your...
but will slowly degraded by the...
No, you have a protein that may be degraded during the process of formation of modification of the polymer.
True. Okay. Thank you, Gianfranco, for your presentation. And the next one.